welcome to Red Cup Conversations. I'm your host, Kris Poliquin, and this is a production of Red Apples Media. If you're watching us on television, you're doing so on Lake Sumter TV, Comcast Channel 13, Bright House 498, and Prism Channel 83. So October is Breast Cancer Awareness Month. So for this episode, we have invited Dr. Katherine Keller from Lake Medical Imaging to discuss some of what they do and why it's just so important. So Dr. Keller, thank you so much for taking the time out of what I'm sure is a busy day to come and share some information with us.
And thanks so much for inviting me to talk to you on this important topic.
Oh, yeah. Again, I want to go to the horse's mouth, so to speak, right? You know far more about it than I do. So let's begin. Tell our audience a little bit about yourself and about Lake Medical Imaging.
Okay, well, I'm the president and managing partner of Lake Medical Imaging, which is an imaging center that's been here since 1965. When I came...
1965.
That's right.
Wow.
We've got some
Okay.
staying power. When I came, I was the 5th physician, and now we have 24 radiologists. So I grew up outside of Washington, D.C. in Maryland, and I did my medical training. No, it was a great place to live.
Okay.
I went to medical school at the University of Chicago. I did my radiology residency at Henry Ford in Detroit, and then a neuroradiology fellowship in Miami. After that, my first and only job has been here in Leesburg.
Is that right?
That's right. How about
Okay.
that? So when I came, there was just LRMC, Leesburg Regional Medical Center, and we had one office across the street from that. Now Lake Medical Imaging has 5 offices. Besides Leesburg, we have 4 in the villages. Mulberry Grove at the northern boundary, Sharon Morse next to the Villages Regional Hospital, Lake Sumter Landing in the middle, and Colony Plaza. Right now we are in the midst of building a beautiful 20,000 square foot facility that will be in the Center for Advanced Healthcare Brownwood on 44 in that big medical office building there.
Wow, really? Okay,
Yeah.
see now my dad's down there, and I've
Yeah.
seen a lot of construction. But that's a rather large facility
Oh
you've
yeah,
got.
it's construction central down there.
Yeah, absolutely. But now, just talking about growth, is there an increasing in numbers? Is that why there's such an expanse on facilities? Or because over my lifetime, it seems like we've started to try to get a little better control of this issue. But it doesn't seem like we are.
Yeah, well, Leesburg's population has only grown slowly, but with the villages and their ever expanding land area, it just keeps growing. So pretty much my practice, once we started serving the villages, has expanded as they have. Now that they're having this large expansion south of 44, it's time to put another facility that can serve that group of residents.
Wow. That's a lot. And the villages is expanding. So all needs are increasing. Medical, fire, everything. But
Yes.
that makes sense. That makes sense.
Yeah.
So then let me ask you, what is the role of LMI in your opinion, or in your own words, the role of LMI in our area?
Oh, well, with our imaging centers and the group of radiologists that serve them, we are the largest provider of outpatient imaging services. And our radiologists are also the radiologists at Leesburg Regional Medical Center and at the Villages Regional Hospital. So what does that mean? If someone needs any kind of test that has to do with imaging and they can have it as an outpatient, that's usually much more convenient for them and less expensive than having it at a hospital. So that's everything from having a chest x-ray or a knee x-ray, an ultrasound of your gallbladder, a nuclear medicine test like a bone scan, a CT scan, MR, PET CT for cancer kinds of things.
Wow.
So all of that. And then there are the different procedures. Instead of having surgery to have a biopsy of something, there are many things now that can be done through the skin, and those are considered less invasive or minimally invasive. So many of those we do in our offices, but then the more involved ones we do at the hospitals, and that's what the interventional radiologists do. So angiograms and angioplasty and drainages and percutaneous ablation of tumors and a
Right.
million things. So that's all what we do. Mostly it has to do with diagnosis of disease, which then helps a patient's primary doctor to best decide how to take care of them and tailor the treatment for whatever is the matter, and follow up on that, see how well the treatment is working. But also there are some procedures where it's therapeutic what the radiologists do. You know, the biopsy helps for diagnosis, but the therapy part is because you open up a clogged blood vessel or drain an abscess instead of having to go have general surgery. So it's that whole range of things that encompasses radiology, and that's what we do here.
That's all.
That's all.
That's it.
all.
That's
Yeah.
all we really do.
Yeah.
So, with all this imaging technology and with your tenure here with LMI, you must have seen so many different advances in that technology. It's got to have helped diagnose, I guess, earlier than what it used to be in the past.
Right, absolutely. So I've been here for 31 years, and if you add in my training, that's another 5 years I've been in imaging. And it has absolutely changed tremendously. Think about what's happened for other things. It used to be you didn't have a microwave or a cell phone, right? Or the cell
Right.
phone you had was in a suitcase.
Yeah.
Now you have a whole computer in your hand. Same with imaging. The advances in computer processing mean that when you have a CT scan, it takes about 1 minute. When I first started out, it was 45 minutes.
Wow.
So that's a huge difference. There are, within the different kinds of imaging, there are advances so that it's faster, better, more accurate, safer, less uncomfortable, all those sorts of things. And then there are brand new things that didn't exist when I was first in training, like the PET CT scans to look for cancer, or some of the advanced imaging for detecting breast cancer. We could talk for all day long about that.
Right. And that's something that I guess for the older generation, maybe the villagers specifically, actually, I don't know. I'm pretty sure they're aware of everything that's out there now because they have more doctor's appointments than I do. But I think that plays a very critical role in, well, I guess the effectiveness and efficiency. I mean, we're going from a minute to 45 minutes. Oh, I'm sorry, 45 minutes to a minute.
Yes.
That is, that helps the community or us, people in general.
Right.
Instead of waiting for your results to come in the mail or something,
Yeah. Well, that's a big, important part for Lake Medical Imaging is to help serve the population, which in large part is the villagers are in an age group that tend to have more need for medical services. So if they can stay here in their local community and have all the different kinds of imaging and services that they might have otherwise had to go to Orlando, Gainesville, Tampa,
Right.
it's much more convenient.
Oh,
So
absolutely.
that's what we try to do, is to stay reasonably on the cutting edge, not the bleeding edge of things, but always bringing new procedures and new ways of imaging and treating the patient, and trying to put the patient first in that.
Okay. And now I'm speaking of the villagers, but that's not your only
course not.
customers, right?
No,
Okay.
no.
Okay. I just want to be clear because I don't want anyone in our audience to think that they can't utilize your services
Oh, no.
unless they're a villager.
Right. So all of Leesburg, we have patients that come from Claremont and Mount Dora, and then there are some that have a long-standing relationship with us, so that even though they've moved away, they still will come here from Melbourne and farther away because this is their imaging home. They
Right.
want to come back.
Right. So let's jump to breast cancer awareness because this is
Okay.
Breast Cancer Awareness Month. And I know you could probably explain all of the intricacies, but generally speaking, what exactly is, when we say breast cancer, what are we talking about?
Okay, so all cancers, including in the breast, are when the normal cells in an organ go haywire and they start to grow out of control. And why does that matter? Well, because then they will take over different parts of your body and make that new area unable to function. So a breast cancer tends to start in the milk ducts and in the milk glands, and when it breaks out of those structures, it spreads to the rest of the breast and then to the lymph nodes in the armpit, and it will invade the blood vessels and the lymph vessels, so then it can go everywhere. So breast cancer often spreads to brain and bone and lung, and the best thing to do before any of that happens is to try to find it when it's small and treatable so that you don't get involved in the more dire situation.
And now, is it true that breast cancer is the number one cancer found in women?
It's the number one cancer found in women in terms of diagnosis, but the number one cause of cancer death is lung cancer.
Oh, is that right?
Right, but
Okay.
that's diminishing as fewer women have been smoking over the years. But every year there are about 330,000 new breast cancer diagnoses, and every year about 42,000 women die of breast cancer. As far as the women that have breast cancer and are living with it, have been cured or whatever in the United States, it's a little over 2 million.
Wow, really?
Yeah.
Okay. Well, Dr. Keller, we need to take a quick break, but when we return, we'll continue our conversation. We'll see you in a moment. Hi, and welcome back to Red Cup Conversations. Again, I'm your host, Kris Poliquin, and this is a production of Red Apples Media. Before the break, we were talking with Dr. Cathrine Keller from LMI, Lake Medical Imaging, about what they do and the importance they have in our local community. So, Dr. Keller, again, thank you for being on the show. And what I would like to do is kind of shift gears and talk about the importance of early detection to kind of let our audience know who may be in harm's way, who should be tested, what can they do to get themselves tested?
Absolutely. So unfortunately, there's nothing that a woman can do or not do to keep herself from having breast cancer. So the best protection is early detection. And that's because if you can find a breast cancer earlier, then it's very likely that you can be cured of it and you will be a survivor that just had breast cancer, which is great. So who needs to be tested? The most lives are saved, without a doubt. All the different agencies that make screening guidelines agree. Most lives are saved if women begin screening at age 40. There have been lots of guidelines that come out and kind of contradict one another, but the statistics are clear. If you start at 40 and have a mammogram every year, that saves the most lives.
Really? Because, and there is a lot of, well, there's so much information now that people can get lost in those weeds.
Yes, and it's hard that way. So the women in their 40s have the most time left to live compared to older decades, and so that's why for them, breast cancer detection is especially important, even though there are fewer women in their 40s than older ladies that get breast cancer. So the trouble with being younger and having breast cancer is that those cancers tend to be more aggressive and grow faster. Plus, they can be harder to find in women in that age group because they have dense breasts. But getting back to who should be screened is the fact that every decade the risk of having breast cancer increases. So starting at 40 and every other year until you get to a point in your more senior years where you and your doctor think that you have fewer than 5 to 10 years left to live. These days, some women are very healthy for quite a long time, into their 80s, and so
Sure.
you can't pick an arbitrary age like stop at age 74 and have that really be useful. That's the time after age 74 that you really have to tailor it to the woman's health and longevity prospects and those sorts of things.
Okay, so what it sounds like to me is that just because you're young, you have less risk, but there's still risk. Don't just think because you're young, you're okay.
Right.
As well as the older generations as
Right.
well. Just because
Right.
you've made it so far doesn't mean you're out of risk either.
Sure, sure.
So there's no safe zone.
No. Your biggest risk is being alive and having breasts.
Well, that's
That settles
everybody on the planet.
Yeah.
I mean,
Yeah, if you've got ovaries, you're in trouble. So,
right.
Yeah.
Oh.
So women in their 40s, you're right, they have less than the older women, but it is a more aggressive cancer. And for the women in their 40s that don't get screening mammograms every year, it turns out of all the women dying of breast cancer, most of them are the ones that are not getting screened. So that helps to reinforce the idea that if you do get screened, you'll find it when it is smaller and more likely curable. So that's why it's important to start in the 40s, without a doubt.
And you recommend, or I think the standard is still once a year?
Once a year.
Is there any
saves the
benefit
most-
to doing it more than once?
The
Doesn't
only
seem
time-
like it, but
No, the only time to have a mammogram or some breast imaging more frequently than that is when a woman actually has some problem that you're trying to work out or follow. But just for screening, which means a lady has no symptoms or signs, no breast pain, no breast lump, no nipple discharge, then once a year is fine.
okay. Now you touch base on the density.
Mm-hmm.
How is that an important factor in whether determining or just is it a cautionary tale type of?
Yeah, well, I'm happy to tell you about that. The density has to do with how the breast tissue looks on a mammogram. So remember that a mammogram is a black and white image,
Okay.
okay? And the dense tissue is normal tissue in the breast. It's fibrous and glandular tissue, and it shows up white on this black and white picture.
Okay.
Well, the only reason that matters is that cancer shows up white too. So you can imagine that to see white in a field of dense white tissue was hard. It's like seeing a snowball in a snowstorm, difficult to pick out visually. So the trouble with dense breast tissue is that it masks or hides a breast cancer. And if you
Okay.
have a lot of dense tissue, then it hides it the most. Some ladies don't have so much dense tissue, and so there are areas of white on the mammogram and also different shades of gray, but to see a white cancer superimposed on that is easier. You know, think about seeing a white snowball on a field of brown grass. Well, that's easy to see, right?
Right.
So easy to pick out. And that's what the density problem is. Foremost, that it hides cancers. Then there are some aspects of it that have to do with the fact that the fibrous and glandular tissue that makes up the dense tissue is kind of the fuel for where a cancer can start. So if you have more of it, then there are more places a cancer can start. So
Okay.
that's why the mammograms are not always the best thing. In ladies that have the dense breasts, you can miss as many as 1 in 3 cancers. So what has anybody done about that? Well, that's where the 3D mammograms came along, where they look at the breast by looking at it as if it were slices. So it tries to better see if something's hiding by, how can I say, as if you were like turning the pages in a book. You know, if there's something in the middle of the book and you only look at the top and the bottom, you're not going to see it. But if you could open
Okay.
the book, you'd see something that were inside. So that's the idea, that if you look like slice-like pictures of the breast, you'll see more. Doing that, you can find 1 or 2 more cancers per 1,000 women. That's great. But still, with really dense breasts, not so good. So that's where the other things come in. What Lake Medical Imaging does that is not at all widespread in the state, but is excellent, is the contrast-enhanced mammogram, which is the Centibrite. And what's good about that is that it sees the anatomy of the breast, such as in the mammogram, but also the physiology, which is how the tissue is functioning, and will highlight areas of abnormal blood flow. So a cancer has to make new blood vessels to grow, and they're a little bit abnormal because cancer is abnormal, and they leak the contrast that you inject, and it really shows up. So you can see the mammogram picture, and then this contrast-enhanced picture subtracts away all that dense tissue so it's not obscuring anything and shows you the little highlighted cancer. It's fantastic. It finds as many cancers as a breast MRI, but it costs less. In our area for Medicare, that's $160 compared to $400.
Wow.
It only takes 10 minutes instead of 30 minutes. It's much more comfortable. It's safer. And it's less anxiety provoking for the patient because she can come where she comes every year for her mammogram and see the same text, and it's
Right.
on the same machine. So I think it's a very efficient way to manage the ladies that have the dense tissue, and also there's a lot of problem solving you can do with it. So it's been a great test.
Okay. And now the problem solving, again, that's early. Are you alluding to the early detection and say, look, we caught something,
Yes, yes.
not sure what it is, or we know what it is?
Right.
and then
Sometimes
can-
you see something and you have to be certain what is it really abnormal or not and do something extra. So sometimes taking extra pictures, doing a breast ultrasound, doing the contrast enhanced, and then you know whether you need a biopsy or not.
Okay. See, that's the kind of information I like to get out right there. To me, up until this very moment, I was thinking it was still just, now I'm a gentleman, but I'm just mammography.
No,
We really have advanced.
yes, yes indeed. It's a real game changer to be able to do these extra things because you can find out better who really needs a biopsy and who doesn't. So a lot of biopsies can be avoided, which is fantastic. And then it more clearly makes the radiologist confident when something does need a biopsy, and you can more easily proceed to find exactly the right spot to biopsy and get to a diagnosis rapidly. So when we find something suspicious, we can usually get the biopsy done in 5 working days, and that is fast. In other parts of
Sounds
the
like
country,
it.
you can wait 30 days, 60 days to have a biopsy because
Really?
they're so backed up. So we try to do it fast, and the pathologists in the area are very good about getting the results back fast. And then the lady, if she needs surgery, she can have surgery or have radiation if she needs that or whatever else. So that's important to get these things when they're early and small and then take care of them right away.
Absolutely. Absolutely. Well, Dr. Keller, thank you so much for coming on the show and giving us this vital information, right? Like literally. If someone wanted to get more information on LMI and what you do, where can they get that information?
Well, they can go to our website, which is lakemedicalimaging.com, and find about all sorts of imaging and our locations and such and phone numbers. But as far as breast cancer specifically, the American Cancer Society, the rudents.org, those are good places to look up additional information.
All right. Well, again, thank you so much. And that does it for this episode of Red Cup Conversations. I've been your host, Kris Poliquin. We'll see you next time.